Hi, my name is Sadie. I'm going to be doing your head to toe assessment. I am a nurse practitioner student. Do you have any questions?
No.
Okay, I'm going to go ahead and start by asking you your name. Can you tell me your name?
Ron Medina,
Can you tell me your date of birth?
3/12/94,
Do you know the year?
2024.
Do you know where we're at?
Home.
And do you know what we're doing?
A head to toe assessment.
Okay, so he is alert and oriented to place, time, situation, and self. So he's alert and oriented times 4. So I'm gonna go ahead and start by asking you to count from 10 to 0.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
Okay, so calculation is correct. Now I'm gonna go ahead and start by asking you a set of, I'm gonna give you a set of things and you're gonna tell me what they belong to. Red, white, and blue.
Colors.
Truck, car, boat.
Cards.
Yes. Okay, I'm gonna test your long-term memory. So I'm gonna tell you a sentence and at the end of the exam, you're gonna tell me what it is. The car is black. So you're gonna tell me that sentence in the end, okay? And that's gonna be testing for long-term memory. So his language is fluent and he is comprehensive. So now I'm gonna go ahead and start by looking at the face and assessing cranial nerve 7. So I'm gonna look for any droopiness, any facial movements, anything like that. Face is symmetrical. His eyebrows are full, evenly distributed. Eyes are symmetrical. There's no swelling in the eyes. There is no drainage from the lacrimus apparatus. Eyelashes are full and evenly distributed on both eyes. Nose is in the middle. There's no deformities on the nose. The lips are pink. There is no, the lips aren't chapped. Face is, the color in the face is appropriate for ethnicity. So now I'm gonna test the muscles of the face, and that's gonna test for cranial nerve 7. So can you lift your eyebrows? Can you smile? Can you frown? Can you puff out your cheeks? So cranial nerve 7 is intact. So now I'm gonna go ahead and examine the hair and the scalp for any deformities, any contours, anything like that. Hair is evenly distributed and there is no deformities or masses or anything on the skull. I'm gonna palpate the cervical lymph nodes for any size or any lumps or anything noted, and there's none noted on the lymph nodes. I'm gonna also palpate the thyroid gland where I'm here. The thyroid gland is not enlarged. There is no goiters or anything like that noted. And then I'm gonna go ahead and examine the trachea. The trachea is midline. So I'm gonna test cranial nerve 2 with confrontation, your visual. So I'm gonna go ahead. Can you follow my finger? Okay, so cranial nerve 2 is intact. I'm gonna assess for the position and alignment of the eyes, and the position is equal on both sides. Conjunctiva and sclerae. The conjunctiva is pink and sclerae is white. I'm gonna go ahead and shine a light in your eyes. So just stare it in front of me. Okay, pupils are equal, round, and reactive to light. And that is also checking for cranial nerve 2 and 3. I'm gonna look at the cornea and the iris for any opacity on both eyes. Just look straight. There is no opacity. Blood vessels look normal. Oh, wait, other side. Again, vessels are normal. There is no opacity noted. So now I'm gonna test cranial nerve 3, 4, and 6 for ocular movements. You're gonna just follow my fingers. So cranial nerves are intact. Now I'm gonna look inside your ears and assess your ears and also test for hearing. So we're gonna test the hearing first. Cranial nerve 8. I'm gonna whisper something and you're just gonna tell me what it is, okay?
5.
Red. So cranial nerve 8 is intact. Now we're gonna do the Weber and the Rene test, and that's also part of cranial nerve 8. Let me know when you hear the vibration, okay?
Yes. Yes. Yes.
Okay, now we're gonna do.
Yes.
Okay, so cranial nerve 8 is intact, and that's using the Rene and Weber test. So now I'm gonna inspect and palpate the tragus. You move your jaw up and down. That is intact. I'm gonna inspect the auricles while I'm here. They are normal. There's no signs of protrusion or anything like that. They're red. I'm gonna look inside your ears. They're nice and pink. I'm gonna examine inside your ear canal using the otoscope. There's no signs of discharge, and tympanic membrane is pearly gray. Now we're gonna look at the other side. Again, there's no signs of discharge, and tympanic membrane is also pearly gray. Now I'm gonna go ahead and test for cranial nerve 1 for sense of smell. And you're just gonna tell me what the smell is, okay?
Hand sanitizer.
Okay, cranial nerve 1 is intact. Again, nose is midline. There's no signs of deformity. I'm gonna go ahead and look inside your nose. Nose is nice and pink on both nostrils. There's no signs of discharge noted. Can you cover one nostril and then smell and then the other one? Okay, so nose is patent. There's no signs of obstruction. Okay, now I'm gonna look inside your mouth at the oral mucosa. You open your mouth. It is nice and pink. I'm gonna inspect the roof. Also, the soft palate, nice and pink. Dental is normal, no signs of cavity, nice and white. Can you stick out your tongue? Move it left and right, up and down. There's no ulcers. Can you stick out your tongue and say ah? And uvula moves up and down, so that is intact. So for that, we were testing cranial nerve 7, 5, and then since we assessed his speech earlier, that was also intact. So now we're gonna assess for any involuntary movements. There is none noted. I'm gonna push down and you're gonna push up. Can you push up? Okay. Cranial nerve 11 is intact. So now I'm gonna test for muscle strength. Can you lift up your arms? I'm gonna also inspect the arms while I'm here. Elbows, there's no signs of crepitus or tenderness or masses or anything noted. Can you extend your arm? Can you push down? So strength is intact. Can you lift up for arms, back, side? So abduction, adduction, extension, and flexion is normal for the arms. Can you also do the same down, up? So for elbows, abduction, extension, and flexion is intact. Can you push out? Strength is intact. Now we're gonna test your joints on your wrist. No deformities or crepitus is noted on the fingers or the wrists. Can you squish my hands? Strength is intact. Can you push out? And strength is intact on the wrists and the hands. Now I'm going to inspect your legs. There's no signs of involuntary movements, no signs of crepitus on the knees. Can you lift up your knees for me? Can you push up? Strength is intact. So now we're gonna test the ankles. There's no signs of crepitus or anything like that noted. Can you push out? The strength is intact. Push in and then push up, push down. So strength is intact on the feet. Now I'm gonna go ahead and listen to your lungs. Just taking deep breaths. So lung sounds are clear to auscultation anteriorly and posteriorly. So now I'm going to test for sound transmission. Can you say 99? Okay, so voice is transmitted throughout all lobes, anteriorly and posteriorly. So now I'm going to go ahead and listen to the heart. Aortic, pulmonale, tricuspid, Erb's point, and mitral. And heart sounds are regular, S1 and S2 is noted. I'm gonna palpate the apical pulse for any thrills or bruits. There's none noted. I'm gonna go ahead and have you lay down for me. I'm gonna inspect your abdomen. And then the apical pulse was also the API, the mitral. So I'm going to I would inspect the abdomen for any contours, any scars, anything like that. There's nothing noted. I'm gonna auscultate for bowel sounds. Bowel sounds are active in all quadrants. Now I'm gonna palpate with soft touch. There's no tenderness, nor masses, or anything like that noted. So now I'm gonna do deep touch. There again, no tenderness noted. Now I'm gonna percuss. Percussion is tympanic on all quadrants. Now I'm gonna percuss the liver. And percussion of the liver is noted. So now I'm gonna have you sit up. I'm gonna go ahead and percuss for CVA. Actually, I'm gonna see if I can find your spleen and any tenderness. Can you go ahead and lay down again? And this spleen is also not palpatable, which is normal. Okay, sorry. Now I'm gonna test for CVA for the kidneys. And there is, it is negative, so that's a normal sign. There was no reaction from the patient. Can you go ahead and stand for me now? I'm gonna inspect your spine. Spine is normal, there's no deviation. It is nice and aligned. Now I'm gonna have you bend down. Get straighten up, bend back. So extension and flexion is normal. Now I'm gonna have you from side to side. Okay, there's also positive range of motion from adduction and abduction. I'm gonna go ahead and have you walk. So if you could go ahead and walk towards the wall. And then when you walk back, do heel to toe. And then also stand on your tippy toes and your ankles. I mean the ball of your foot. That gait is normal. You could go ahead and sit down. Okay, I am gonna test for your reflexes, your biceps, triceps, brachioradial. Just relax your arm. Okay, biceps, triceps, and brachioradial are intact. Now we're gonna test. The Achilles. Okay, so all the reflexes are intact. I'm also gonna inspect the hips real quick. If you might lean down real quick again. I just extend out your leg on the left or towards the left. And then strength is intact as well. Now do that on the right side. Okay, that's also intact. The hips are also positive range of motion. Can you sit up? So there is range of motion, 5 out of 5 on all extremities. Now can you go ahead and tell me the sentence that we said in the beginning?
The car is black.
The car is black, so long-term memory is intact. So that completes our full head-to-toe assessment. Do you have any questions? Okay, thank you.